Selecting a Medicare plan is more overwhelming than ever, especially after the major changes brought by last year's Inflation Reduction Act. Well, today we are joined by a trusted local expert from Matthew Carter with Aines and Associates to break down what you can expect during this year's Medicare enrollment. So great to see you again.
Nice to see you.
Well, this is really important that you're in today because there's a lot of different changes with the Inflation Reduction Act. So what can people expect this year when they're doing those signups?
Big time changes. Last year marked the end of the coverage gap for prescription drug plans. In 2025, once prescription costs reach the $2,000 maximum out of pocket, Medicare beneficiaries pay $0. Due to this, we expect to see rising premiums for Medicare Part D prescription drug plans and Medicare Part C plans. We also expect to see changing maximum out-of-pockets for Medicare Part C plans, and some Medicare Advantage plans may be discontinued in certain areas.
Okay, well, that's really good to know. And that's why it's so important to work with a professional who has been keeping up to date with all of these different changes. So why is it just so important to work with someone who is local and trustworthy?
It is extremely important. This may be your one-time health-free coverage selection into the plan type of your choice if you're turning 65 or retiring. Find a local broker who specializes in the Medicare markets. Don't go to Facebook, don't call people and do business over the phone.
Right.
Access Google reviews and client testimonials to help you with your decision-making process.
Yeah, during this time of year, we are bombarded with so much information. People are wanting you to call like a 1-800 number to get information. Again, like Facebook groups, all the banter on there. So what are some of those common mistakes you see when people are trying to select a plan without assistance from a licensed agent?
Here's some of the common mistakes that we hear about and have to fix. I didn't have a prescription. I don't take prescription medications, so I don't need a prescription drug plan. I base my Medicare plan option off of my employer plan. I pay $0 monthly for my Medicare supplement. Or finally, I'm just going to do what my friends did. All of these represent bad decisions by Medicare beneficiaries.
Yeah, just going off of what your friend does. I mean, these are all individualized, so you can't just base it off of someone else. So a lot of people are still working past the age of 65 nowadays. So should people keep their employer plan or should they sign up for Medicare?
That depends on several different variables. Before that decision can be made, factors like Medicare income penalties, employer plan credibility, coverage, prescription drugs, and cost must be evaluated. We walk our clients through the process of making that decision that's the best choice that suits their needs.
Really getting individualized. And if you were to give us somewhat of a checklist when you get signed up for some of your services, what are some of those things that people should bring with them in order to get this right?
Current coverage details, if applicable, prescription drug usage, the pharmacy they want to use, and a willingness to learn.
All right. Well, thank you so much for stopping by today. If people are interested in getting in touch with you or the rest of your team out in LaGrange, how can people do that?
Yeah, just come by our office in downtown LaGrange, email us at info@ainescarter.com, or set an appointment for our satellite office in Louisville.
All right. I know you're going to start booking those appointments starting on October 1st, so time is ticking.
Absolutely. And you can make as many changes as you want to during the Medicare annual enrollment up until December 7th.
Okay, good to know. Well, Matthew, thank you so much for stopping by today.
Thank you.
All right, so again, just call the number on your screen, send them an email, or go to their website, ainescarter.com.